Hello, everyone. My name is Roxanne Chabot from RBC Consultants. Welcome to another Skin Chat. Today, we're going to be talking about over-the-counter products as an adjunctive acne care in Asian phototypes, improving outcomes and managing side effects. As speakers today, we have Dr. Xiang Jiang, who is Professor Chair, Department of Dermatology, West China Hospital of Sichuan University, Committee Member of Chinese Society of Dermatology, Committee of Laser Cosmetology Group in the Chinese Society of Dermatology, and Committee of Laser Group in China Dermatologists Association. We also have Dr. Kanukvale Kulthanan, who is Professor of Dermatology, Department of Dermatology, Faculty of Medicine, and Sirajaj Hospital. This is in Mahidol University, Bangkok, Thailand, and President of the Dermatological Society of Thailand. We would like to thank our sponsor, CeraVe, for making this educational event possible. A couple of logistical tips before we start. If you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. If you're having technical issues or if you'd like to submit a question to our faculty, please submit your question in the question chat pane on the right-hand side of your screen. At the end of this webinar, a survey will be emailed to you 1 to 2 days later. If you could please fill in this brief survey, we'd truly appreciate it. And within 1 to 2 days of the webinar, a recording and a certificate of attendance will be sent to you. Again, if you want to submit a question, please submit it in the question chat pane at the right-hand side of your screen. I wrote a little note there for you so that you can see where you need to type in your questions, and we will be taking questions, time permitting, at the end of this session. So without further ado, I will pass the floor virtually to Dr. Jiang.
Hi.
Hello, Dr. Jiang, welcome.
Nice to meet you again. Hello, everyone. Good morning and good evening. Okay, next slide. Good morning and good evening. Today, we'll discuss the adjunctive acne care in Asian phototype. Why we should choose over-the-counter products. Why will it improve outcomes and managing the side effects? Next slide. So today we'll discuss the acne in Asian phototypes, and also we'll discuss the pathogenesis and the therapeutic options and the challenges our doctors facing. And also we'll discuss the role and functions of moisturizer and cleanser in treating acne. For dermatologists, how and when we choose this product to help our patients. Next. So in December 2020, an advisory panel consisting of key opinion leaders and dermatologists with experts in the treatment and maintenance of acne in Asian skin was held. Fortunately, I am one of them. After in pre-meeting survey and discussion, the panel has the paper over-the-counter products as adjunctive acne care in Asian phototypes to improving outcomes and managing side effects. And this paper has been accepted. Next one. And this is the method of this paper. Before the meeting, we do the pre-survey, and during discuss, we have a lot of opinion together, and then we do some paperwork, and thus this paper was had. Next one. So we should answer question, what is Asian phototypes? Next. And we mean that Asian refers to a large group of peoples, and Asian with diverse skin types from type 2 to type 4, even 5, and the skin color of Asians from very light to very dark. And also the climate in Asian countries range from tropical to arid. That's why there is a difference in the clinical manifestation of acne in Asian people. Next. And in the world, acne is the most common dermatological problem and disorder in the world. We can see a different prevalence in the world, but acne is number one. Next. Especially in women from 20 to 30 years old, the acne is very, very popular in this age people. Next one. And according to the data from 11 papers published between 2000 to 2012, the acne prevalence in Asian phototype almost close to 50%. And in some study in China and Korea and Singapore, the prevalence is very higher. Next. And from this study, the prevalence of acne, this study compare the prevalence of acne in different ethnic group, and we can see the prevalence is different. And Asian is 30%, and for African American, the prevalence is almost close to 40. That means that from the different ethnic group, the prevalence is different. And how about the characteristic and clinical manifestation of Asian women with acne? Is there any difference? There are a lot of studies was confirmed. In Asian women with acne, there are more inflammatory lesions was found, and also the post-inflammatory hyperpigmentation, and also some scar. That means for Asian women with acne, will have more sequelae than others, such as PIH, scar, mini scar. Next. So why inflammation is so important in the processes? Let's review the pathogenesis of acne. From this table, we can see the inflammation processes involved in all the steps, and the inflammation is very important in not only in the occurrence, but also involved in the development of acne. It will involve in the inflammation and post-inflammatory hyperpigmentation, and also the mini scar and scar. Next. Especially in the inflammatory acne. We know in acne we have a lot of lesions, the inflammatory acne and non-inflammatory lesions. And the inflammation is everywhere. It involved in every processes of acne processes. Next. And in this US survey, acne was the leading dermatological diagnosis in all non-white population studied. That means in the non-white people population, the acne is the #1 disease. So, but by contrast, in Caucasian people, the top 5 were acne, benign neoplasma of skin, unspecified dermatitis or eczema, and non-melanoma skin cancer. But in Asian people, acne is number 1. Next. And also in this study, in Asian acne people, the patient have more inflammation but in Asian people, maybe we have a lot of inflammation, so we have see the inflammatory lesions. And because this process was related to our skin type, and from this study, we also know that in black skin, the lower rate of nodular cystic acne. So that means the different skin type may have different clinical manifestation of acne. So to our doctors, we should define our treatment strategy according to the different clinical manifestation. Next. And we know the acne will have very significant social and psychological and physical consequences, because also some patients may only present with acne during adolescence, but it can reoccur in adulthood, or patients can be left with scarring as teenagers, acne, or result as a pigmentation after acne. And all this will result in a potential lifelong impact on these people. So acne can have very, very bad effect on the life quality of the patient. For doctors, we should pay attention to this impact on the social, psychological, and physical consequences. Next. Let's go to see the acne sickness in Asian phototype. It's very, very common, such as a acne-related post-inflammatory hyperpigmentation. So PH is very, very popular in our patients, especially in Asian acne skin, and also mini scar and scars, and also their impact on the quality of life. So for doctors, we should pay more attention to this disease and should pay more attention to the pathogenesis of this disease. And for Asian doctors, maybe we should pay more attention to the inflammation effect on the acne. Next. That's a polling question. In your country, for whom is inflammatory acne is more prevalent than comedonal acne? Please choose 1: African American, Asian, Continental Indian, Caucasian. So which one you choose? Oh, yeah. So that's a result. Asian. It means the right answer is Asian. We have mentioned before, in this process, inflammation is very, very important in the pathogenesis of acne. So we need to pay more attention to the inflammation. So let's go back to the therapeutic option for Asian phototype acne patient. So how choose the therapeutic option for this kind of people? Next. The skin type, phototype from 2, 3 to 4, 5, maybe from dark brown in Asian Pacific. That means for this kind of people, it tends to consist of more melanin than others. And for this melanin, allowing for superior natural photoprotection, while also increase the risk of pigmentary disorder. That's why in our clinic, we can see a lot of PH after acne. So that's the reason, because for the Asian and Pacific people, we have more melanin, and that's why we are more prone to have the PH. Next. And according to the international guideline, a topical retinoid plus antibiotics is the first-line therapy for the majority of acne. Next. And also in patients with inflammatory and comedonal lesions, we can the best results may occur when topical retinoid are used in combination with antibiotic therapy. That means for the inflammatory and comedonal lesions, the first-line therapy is the retinoid plus antibiotic treatment. Next. Because the topical retinoid may affect skin permeability by weakening the layer barrier, enhancing the penetrating of topical antibiotics. That's why we need to combine these two methods together. And during the topical retinoid therapy, the skin surface collacyte loosen and the number of cell layers is reduced, and the retinoid will normalize the hyperkeratinization. And we know the pathogenesis of acne, so the retinoid is very, very important to affect the acne. Next. And from the algorithm for acne treatment, the skincare products are recommended, such as cleansing agents, skin barrier repair product, and we know in acne, the skin barrier function maybe have some little problem. So besides the drugs, we can use some skin barrier repair product to restore the skin barrier function. Next. And also from this guideline on the management of acne, vulgaris in Southeast Asian patient, the expert group recommended that acne patients should use skincare product to improve adherence during prevention, treatment, and maintenance. Next. And this table lists the safe and effective treatment options for skin of color acne patient. We can see a lot of drugs, retinoid, adapalene, clindamycin, and dapsone, and tazarotene. A lot of drugs we can use. Next. However, from these guidelines, topical retinoids are recommended as the first-line treatment in acne guidelines, especially useful in patients with darker skin because the retinoid have dual effect, not only on pH, but also on the acne. But we know for all acne patients, we'll educate the patient, we'll ask the patient to use their retinoid be titrated. Why should it be titrated? Because we know that retinoid will have some irritation. If we use it titrated, we can decrease irritation and maximize efficacy. That's why that's the way we use retinoid. Next. But in order to have the best clinical outcomes, our doctors always combine treatment strategy to combine the different drugs together to have the best safe and effective strategy. So we combine the 2 or 3 drugs together to have the best result. Next. But in the Asian acne patient, we have all mentioned before, because the skin type, because the melanin contents, the combination treatment also cause some side effects, such as if the patient uses retinoid, it will have some burning sensation, sticking, dryness, peeling, and irritation. The patient will complain, blah, 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 blah. So the Asian acne patient display greater sensitivity and less tolerability than Caucasian people. So for doctors, we should pay more attention to educate the patient how to use the retinoid acid, how to use the treatment strategy, and to avoid the side effect. So as a result, our doctor will choose a topical regimen to our patient very, very carefully in order to minimize irritation. Besides, we can use some adjunctive skincare product to minimize the side effects and to maximize the tolerability. And for the Asian acne patient, skincare product is very, very important in the whole processes of the acne, not only in prevention, but also during treatment and also during the maintenance. It's useful and helpful to the best result of the treatment. So that's my discussion today. And the next speaker is my colleague, Dr. Kusena. Welcome to Dr. Kusena.
Thank you very much. Hello, everyone. It's my great pleasure to be here. My talk will focus My talk will focus on the role of OTC products, moisturizers, and cleanser in the Asian phototype acne patient. As Professor Jiang has already mentioned, the panel members completed a survey on OTC products role and skincare in acne treatment in patients with Asian phototypes. The survey examined which OTC products were recommended for acne monotherapy, for adjunctive treatment, and for maintenance. Who used this product, when, how, and why the products are recommended. This table shows the result of the choices of OTC product for acne monotherapy. The first choice, the second choice, and the third choice. The choices of OTC product for acne adjunctive therapy. You can see the first choice like this, second choice, and third choice. The choices of OTC product for acne maintenance therapy. Why skincare? We need skincare in addition to acne treatment. Acne-affected skin may be prone to irritation, resulting from acne treatment. And we know that systemic and topical medication, such as retinoid, antibiotics, and benzoyl peroxide are associated with skin barrier alteration, causing irritation and dry skin condition. So these unwanted effects can reduce adherence to treatment and therapeutic outcome. OTC non-comedogenic cleanser and moisturizer have been successfully used to reduce skin irritation. Products with high pH are shown to interfere with the efficacy of topical treatment. This is the data of acne cleansers and moisturizers action and feature from a Latin American survey completed by dermatologists. The information may pertain to acne patients with Asian phototype. So let's see the detail. OTC product can use for acne treatment as monotherapy, adjunctive therapy, and maintenance therapy. Benzoyl peroxide containing product, salicylic acid, glycolic acid, and retinoid containing product are effective, but may can cause some irritation or adverse effect. Azelaic acid can help to treat mild and moderate acne and also PIH. Ceramide containing cleanser and moisturizer support the removal of excess sebum and debris on the skin surface and improve skin barrier function. AHA, BHA, and sunscreen may help to treat PIH. Let's focus on the survey of Asian countries. For recommended OTC product, Asian skin tends to be more sensitive than other phototypes. Irritants commonly included in the cleanser for acne-prone skin may lead to greater severity of irritation. So concentration of potentially irritated ingredient may need to be lower, or less irritating ingredient should be considered. Or we may add ingredients capable of counteracting the transient irritation. Cleansing liquids were preferred over baths. Dry skin in acne patients may occur due to treatment or procedures. Skin dryness and irritation are particularly problematic in darker skin type and can increase the risk of PIH. Moreover, irritation can result in pigmentary sequelae, so more tolerable formulation such as cream, lotions, and aqueous gel with hydrating ingredient may decrease the risk of dry skin and irritation. In Europe, the US, and in Asian countries, OTC acne treatment and skincare have been successfully used to reduce skin irritation. For acne and skincare, relevant OTC products may include skin cleanser, moisturizer, and sunscreen. And these products may offer several benefits to acne-prone skin, such as reducing oiliness, redness, inflammation, pain and discomfort, improving skin texture, time for lesion to heal, extent of scarring, and the number and the severity of acne breakouts, so thereby improving treatment compliance and outcome. So it is interesting to explore skin barrier composition and function differences in acne. This slide shows recent acne guidelines. You can see that half of them emphasize skincare as a part of acne treatment. We have a polling question for the audience. Which of the skin barrier composition has been demonstrated to be decreased in acne patients? Free fatty acid, linoleic acid, ceramide, or all of the above? Please choose one. Here is the result. So most of the audience choose number 4, all of the above, which is correct. The right answer is all of them are decreased in acne patients. So let's see the detail in the following slide. Decreased ceramide level have been demonstrated in acne patients. Ceramide levels are significantly reduced and transepidermal water loss is significantly higher in patients with acne. You can see this. So acne compromise barrier integrity. For functional change include higher sebum excretion, larger sebaceous gland, and subclinical inflammation. Ultrastructural change include increased filaggrin expression, decreased free fatty acid, linoleic acid, free sphingosine, and total ceramide. Ceramide levels are significantly reduced in patients with many inflammatory conditions, including acne. So on your right-hand side figure, you can see that ceramide levels are significantly reduced in patients with acne, and the level were lower in patients with moderate acne. Figure on the left shows decreased ceramide levels in patients with atopic dermatitis. For acne and skin barrier function, stratum corneum barrier function dysfunction in acne patients directly affects comedogenesis and inflammation. There was a Japanese study on male patients with mild to moderate acne and control subject, evaluated sebum secretion, lipid, transepidermal water loss, and conductance. Acne patients exhibit markedly higher sebum secretion, greater transepidermal water loss, and decreased stratum corneum hydration, which was more significant in those with moderate compared to mild acne and normal control subject. Acne patient stratum corneum had significantly reduced free sphingosine and total ceramide. Impaired water barrier function in acne was demonstrated by the result of water absorption desorption test in this figure in patients with mild and moderate acne compared with control. And you can see in the table that transepidermal water loss were higher and the conductance value were lower in both moderate and mild acne group than those with control. This table 2, show mean weight of stratum corneum lipid fraction of acne patients and control subject. And table 3, this table show mean percentage of free sphingosine and total ceramide from stratum corneum of acne patients and control subject. The result suggests that impaired water barrier function may be caused by decreased amount of ceramide, and these may be responsible for comedone formation, since barrier dysfunction is accompanied by hyperkeratosis of the follicular epithelium. Is skin pH different in those with acne? This study conducted in 200 patients with mild to moderate facial acne who did not take any oral anti-acne medication in the last 3 months and compared with 200 control. They were instructed to refrain from using cleanser and topical application to the face for 24 hours prior to pH test. The result shows significantly elevated pH in acne patient in both genders. Acne patient in blue dots and control in red dot. You can see that mean pH of control 5 and for acne 6.3. Let's look at moisturizer and cleanser ingredient in acne skincare formulation. Cleanser and moisturizer ingredient. The skin of acne patients may be ceramide deficient. So when in contact with harsh acne treatments, skin side effects may occur. Daily application of fragrance-free, non-irritating, and non-comedogenic cleanser, moisturizer, and sunscreen may reduce adverse events, such as PIH, resulting from topical drug. And skincare have been successfully used to reduce skin irritation and can be especially useful in sensitive skin acne patients. Adjunctive skincare can play an essential role in preventing, treating, and maintaining acne. So when selecting a cleanser and moisturizer for acne and acne-prone skin, individual and cultural variation in skincare prevalence should be considered. However, it should be kept in mind that some skincare and hair care products may exacerbate acne as well. A consensus paper stated that dry skin and skin irritation resulting from acne treatment could be improved using ceramide-containing cleanser and moisturizer, enhancing treatment adherence. The type of acne and individual patient characteristics can help to determine the appropriate OTC skincare. So the preferred OTC product for acne, cleanser that do not contain soap with a near physiological skin pH and moisturizer could be used to improve both topical treatment efficacy and tolerability. It should be cosmetically elegant, non-irritating, well tolerated, anti-inflammatory, and should restore skin barrier function. Hydrating cleanser may be the most appropriate type of cleanser for acne-prone skin or those with acne. Effective moisturizer typically include ceramide, humectant, emollient, oil absorbers, or have anti-inflammatory and barrier replenishing properties. Ideal cleanser and moisturizer should be safe, effective, cost-effective, additive-free, fragrance-free, sensitizing agent-free, pleasant to use, and should optimize lipid and water content of stratum corneum, and should meet patients' satisfaction. Cleanser and moisturizer close to physiological skin pH 4 up to 6 may reduce skin irritation and improve skin barrier function. However, not all moisturizers are created equal. All CeraVe formulation contain ingredients integral to formulation or benefit skin barrier, contain ceramide, and they are fragrance-free, non-irritating, and hypoallergic. Most contain hyaluronic acid, use MVE technology, and are non-comedogenic. CeraVe multi-vesicular emulsion system or MVE is a patent sustained releasing technology. MVE is a multi-phase or in-water emulsion system consisting of a series of concentric spheres of oil and water phase. MVE traps ingredients into its oil or water layer and release them slowly, layer by layer, into the skin over time. This figure compares progressive release of moisturizer ingredient by MVE technology with quick bursts of traditional emulsion. For sunscreen and acne, we know that sun exposure is a contributing factor to PIH, particularly in higher skin phototype. So when counseling and education should encourage the daily use of a broad spectrum sunscreen with an SPF of 30 or higher, sun avoidance and use protective measure, encourage the intake of foods rich in vitamin D or vitamin D supplementation. This paper reported alteration to skin barrier integrity following broad-spectrum UV exposure in an ex vivo tissue model. You can see that application of sunscreen prior to UV irradiation demonstrate a clear protection benefit, as illustrated by the preservation of tissue morphology in an H&E staining, reduction the number of apoptotic cells, and minimize dermoepidermal junction disruption. Prolonged sun exposure significantly impacts the inside-out skin barrier, or we call cell junction. This paper reported the efficacy of ceramide-containing formulation on UV-induced skin surface barrier alteration. A ceramide-containing sunscreen and moisturizer protects against UV-induced skin surface barrier changes by preventing erythema and hyperpigmentation, improving skin hydration, maintaining normal superficial skin cells morphology and turnover. So you can see that in figure A and B, sunscreen alone in green line or in combination with moisturizer in blue line decrease UV-induced erythema and hyperpigmentation, while treatment with moisturizer alone in yellow line similar to UV alone in orange line. And the figure C shows the representative image of UV-induced erythema and hyperpigmentation response. So in conclusion, acne is a multifactorial chronic skin disease that can lead to social, psychological, and physical consequences. Consider topical therapy for your acne patient due to efficacy and minimal systemic side effects. Provide patients with the strategies to minimize side effects, which can help improve adherence. Patients are more likely to adhere to treatment if you educate them on acne and involve them in the process of selecting their topical treatment. Acne is associated with skin barrier dysfunction, which present with a reduced water binding capacity due to multiple factors. Treatment can exacerbate this dysfunction, leading to dry skin and irritation, which in turn leads to poor treatment adherence and suboptimal outcome. OTC monotherapy is used for mild acne, and OTC adjunctive therapy is mainly applied for moderate acne in combination with prescription treatment. Reasons for using OTC maintenance therapy are anti-inflammatory action, prevention of acne flares, oil control, and minimization of scar. Common ingredients in acne products, for example, benzoyl peroxide and retinoid, are effective, but it may cause skin irritation and impair barrier function. Non-comedogenic cleansers and moisturizers can improve dryness and irritation resulting from acne treatment. So we prefer aqueous gel, lotion, or cream vehicles. Acne-affected skin has been shown lower level of ceramides compared to healthy individuals of all ethnicities. Ceramide-containing moisturizer may enhance adherence and complement existing acne therapy. Thank you for your attention.
So now we're going to go for our question period. Again, if you want to ask any questions to our panel, please go on the right-hand side of your screen and write your questions in the question chat pane. Any additional questions can be submitted at info@rbcconsultants.com. Again, thank you to our sponsor, CeraVe, for making this educational event possible. So in terms of questions, Dr. Jang and Dr. Kulthanan, we have one question from the audience. What is a suitable skincare for oily skin?
So oily skin should be treated with the gentlest and lightest oil-free moisturizer.
Okay, next question. If you could summarize the benefits of moisturizer in acne patients.
So moisturizer keeps skin hydrated, reduce skin irritation, and repair skin barrier damage due to topical treatment. Ceramides are natural moisturizing factors. The topical application of ceramides help improve skin barrier function and acne-affected skin.
Dr. Jang, what is the appropriate type of cleanser for acne-prone skin, would you say?
So for the patient, for the acne-prone people, we maybe use some liquid. Maybe we not recommend to use some soup for the cleanser. And also for the acne-prone people, the skin is more sensitivity to some irritation agents. So we should avoid use this kind of ingredients to reduce the irritation.
Dr. Kulthanan, any other comments?
Yes, I prefer that lipid-free cleanser was found to be the most appropriate type of cleanser for acne-prone skin, as they were associated with a low risk of skin irritation and a near physiological stratum corneum pH. Someone would like to introduce the one that have gentle, alcohol-free, and may contain anti-acne ingredient. So that's the option.
Great. Dr. Jang, should we apply moisturizer before anti-acne topical medication? What do you think?
For me, in our clinic, we always ask the patient use the moisturizer before the drugs, especially retinoid, especially BPO, because in the Asian skin, we have mentioned before, we have skin type from 2 to 4-7, and we are maybe more sensitive to this kind of product. So we use this kind of moisturizer to reduce the irritation and to maximize the tolerability. And as a result, the patient will follow our prescription to have very good outcomes.
Wonderful. Dr. Kulthanan, any comments?
To my knowledge, there is no scientific evidence regarding to the best order of application. However, there was a study by Hayanashi et al. Published in Journal of Dermatology. They show that good adherence was achieved by the application of moisturizer before adapalene, perhaps because of decrease in irritation, and the concomitant use of moisturizer with adapalene from the beginning of the treatment did not affect its therapeutic effects, but helped to improve adherence to treatment. So this is some scientific evidence that we can apply moisturizer together with any anti-acne topical medication without losing its efficacy. But the option that moisturizer before or after, it depends on some prevalence. But in this paper, they use they apply moisturizer before adapalene, and they claim that it reduces irritation and make it more adherence.
Thank you. Dr. Kulthanan, what would you say would be an appropriate sunscreen for acne-prone skin?
So we prefer sunscreen formulation which have been shown to be clinically and aesthetically appropriate for use in the management of acne-prone patients. Should be a broad spectrum, non-comedogenic sunscreen with an SPF or SPF of 30 or higher is recommended. And to avoid irritation, perhaps a water-based or light liquid-based sunscreen is the best option.
Dr. Jiang, any other comments?
So for in our clinic, maybe we recommended the patient use a physical blocker more commonly to reduce the comedol. And also if we use some of the chemical photoprotection, the chemical sunscreen, and combine with the physical sunscreen together. And we choose the brand and also choose the ingredient also. And also sometimes if it's possible, maybe we educate the patient to choose the pH if it's possible.
Wonderful. So this is all the time that we have, but we would like to thank Dr. Kulsanan and Dr. Jiang for a very enlightening and informative presentation today. And thank you all for joining us today. Bye-bye, and we'll see you at our next Skin Chat.
Bye-bye.
Bye.
See you.
Bye.
Good night. Hope to see you again. Dr.